This is Lisa Henderson, editor for Applied Clinical Trials, and I'm here today with Dr. Linda Strauss, Executive Director and Head Clinical Operations, VICAL, and research scientist and founder for the Institute of Palliative Medicine and San Diego Hospice IRB. Linda wrote an article that went through our peer review process, and it is being published in our March issue. However, this article isn't written from the perspective of VICAL. Linda's article before press is titled Oncology Clinical Trials, Ethical Issues Pertaining to Subjects Facing Life-Threatening Disease, and is based on her personal experiences of her husband's diagnosis of glioblastoma, which is an extremely aggressive, highly vascularized, and incurable brain cancer. So, Linda, thank you for joining me today. With recruitment, what do you think gets to the heart of reaching people? Is it that science? Does it turn them off, or is there a disconnect?
You know, Lisa, it's a good question, and many would say we don't really explain it to the level of the patient. The lay public doesn't really understand it. There are companies out there, SysScript comes to mind, that really has a mission to educate the lay public on what clinical trials are. But truthfully, when you get to an incurable cancer, step back. When you get to any cancer, the big C, that word nobody wants to hear, people start looking. It's hard to, somebody said, a friend of mine actually, her niece was diagnosed recently with glioblastoma, and she wanted me to talk to her, and the first thing she said to me was, well, she's in denial. Lisa, between you and I, it's hard to be in denial today. All you have to do is Google the disease. We're way beyond, the chit-chat between doctor and patient, and that's all you know. I mean, everybody goes. So I think it's more complicated than that, and that's part of the reason I wanted to write the paper. I think we need, as an industry and as physicians and healthcare providers, to make clinical trials on the forefront of every single time a patient or family member walks into the office. Because what happens is you hang on to hope. So you get the results, and they say, we're going to do this. And you go, okay. And, by the time you get home, I used to tell my sons, I go, I'm pretty smart. I do this for a living. I had my 3-ring binders every day. I went to the doctor's with my husband. And Randy and I would sit there and we'd listen, and I'd even write down all my questions. And I'm telling you, 90% of the time I went home and went, I didn't ask this question. I didn't ask that question. So when it comes to clinical trials, we're making decisions on our healthcare within this silo, and in parallel, clinical trials are out there. So often, which is what actually happened to Randy and I, by the time we were ready, and that means in cancer that standard of care isn't working. You really at that point have two options, clinical trials or hospice, because there is no other choice out there. Most people who applied for cancer clinical trials have failed the standard of care, especially when it comes to an incurable cancer. So by the time I was ready, I had made treatment choices in a vacuum that ultimately excluded him from the few clinical trials I was actually looking at. And I do feel that if at every time we sat down with our oncologist, he or she said, okay, I just want to tell you one more time the few clinical trials that are available and what their inclusion criteria. But it becomes an ethical issue. I mean, can my doctor really look at me and say, Linda, if we do one more round of radiation, Randy won't qualify for this? Is that coercion? Is that crossing that physician investigator therapeutic misconception line? There's no right or wrong answers. They're just very difficult ethical decisions.